Hi guys, welcome back to my channel. This is Dr. Rena Malik, urologist and pelvic surgeon. On today's video, I'm going to be responding to your comments. Thank you all so much for being a part of this community, asking questions, and being engaged, because I wouldn't be here without you guys, and I'm so grateful to each and every one of you. For those of you who are new here, I'm a board-certified urologist who makes video content on urologic education, bladder health, sexual health, and much, much more. If you like what you see, make sure you subscribe and share this channel with your friends. Also, if you want another opportunity to ask questions and get them answered, I am changing the format of my email newsletter. I'm going to be sending out a weekly newsletter where I answer one or two of the top questions from my last video of the week. And that email will show up in your inbox once a week, where you can get answers to the top questions that you guys all ask. So if you're interested in being a part of that, please hit the link in the description down below and sign up. First question I got from Cesar Garcia asks about the possible side effects of Viagra being an erection that lasts 4 hours long. Is that possible? Well, first of all, an erection that lasts longer than 4 hours is called a priapism. And a priapism can be in two different types. It can be an ischemic priapism, where the erection is causing a lack of blood flow to the penis. And that's the more common kind of priapism that we see due to things like taking injections for erectile dysfunction or other medications. Or there are non-ischemic priapisms. And non-ischemic priapism is actually called a high flow priapism. So there's actually blood flowing in and out of the penis, and there's less risk of injury to the penis in the long term. So when you have an ischemic priapism, what you'll notice is that you'll have significant pain and a very firmly erect penis. And this erection is not related to sexual interest or stimulation. A non-ischemic priapism will be less rigid, so it won't be necessarily a very firm erection, and it won't be painful. But if you are a person who develops an erection lasting longer than 4 hours, you must go to an emergency room to figure out if you have an ischemic priapism, because an ischemic priapism is a surgical emergency, meaning that it needs to be treated. First, we'll try medical options and procedural options, and if those don't work, we then take you to the operating room, because during this time, if you have an ischemic priapism, you are causing damage to the tissues of your penis. And if this lasts for longer than 24 hours, it's very likely that you will not have erections or normal erections after this is completed, because you've lost so much blood flow to the penis. But to the question about having it after taking Viagra, it's actually a very rare event with these medications. In fact, it only occurs in 0.1 to 0.7% of people who've taken a medication for erections, whether that's sildenafil, tadalafil, vardenafil, ovanafil, any of the medications which you may more commonly know as Viagra, Cialis, Levitra, and so on. These are extremely rare as long as you're taking them with the prescribed instructions given to you by your doctor. In fact, they did a study looking at medication-induced priapism, and in fact, medications for erections like PDE5 inhibitors or sildenafil, Viagra, etc. were third most common. More common than that, or 2 times more common than that, were things like trazodone, which is a sleep medication or an antidepressant, and 2.6 times more likely than that were things like antipsychotics, which are used for a number of psychological disorders like bipolar disorders, including clozapine, olanzapine, risperidone, and others. Bottom line, these medications for erections are very, very safe, especially if they're taken as prescribed. So the next question is it really true that a person who is circumcised lasts longer while having sex than those who are not? Well, so I've done a study before on the benefits and risks of having a circumcision, so make sure you check that out. But specifically to answer your question, does it help with what we call premature ejaculation, or ejaculating before you're ready for it to happen? And they've done a couple of meta-analyses on circumcision. They looked at 36 studies with 19,000 men who were circumcised and about 20,000 men who were not. And they looked at things like sensation, sensitivity, premature ejaculation, erections, and satisfaction. And of all those studies, they found 5 that looked at premature ejaculation. And they had about 7,600 men who were circumcised compared to about 6,300 men who were uncircumcised. And what they found was that there was no significant difference in the rate of premature ejaculation. It was about 24% in the circumcision group and 31% in the uncircumcised group. And that was not significantly different in those groups. And in all the other areas they looked at, including sexual function, sensation, pleasure, they really found no difference between those men who got circumcised and those who did not. They also found found in these studies that there were people who got circumcised as an adult. So these were not all people who were circumcised as an infant who had no comparison. These were people who actually went on and got circumcised as adults. Is retrograde ejaculation a temporary side effect of this medication, which is an alpha blocker? So alpha blockers are medications that are used for people who have an enlarged prostate. If you want to learn more about an enlarged prostate, I've made a video, a complete guide to an enlarged prostate, so please check that one out. But essentially, alpha blockers work by relaxing the prostate smooth muscle to allow the urine from the bladder to flow better. However, because they cause this relaxation, they also cause relaxation in a few other structures, including the bladder neck, the vas deferens, and the seminal vesicles. Because of this, they can cause ejaculatory problems. And what do I mean by that? Well, they can cause things like decreased volume of ejaculation. They can also cause things like anejaculation, meaning that you're not having any ejaculate, or retrograde ejaculation. And what that is because the bladder neck is relaxed, when the semen is emitted through the ejaculatory duct into the prostate and the urethra, it actually flows backwards into the bladder rather than going forwards out when you reach climax. However, the prevalence of ejaculatory dysfunction is different for different medications. So tamsulosin, the medication which we give very often, also known as Flomax for an enlarged prostate, has a 3 to 11% rate of ejaculatory dysfunction. Silodosin has an average rate of ejaculatory dysfunction at about 20%. So what can you do if you're experiencing that? Yes, it is temporary, which is great. There have been studies looking specifically at tamsulosin, and they found that reducing the dose or doing it every other day can help with restoring ejaculatory dysfunction up to 90% of men. And if you are on silodosin, you can consider switching to tamsulosin or alfuzosin, which is another alpha blocker that have lower rates of ejaculatory dysfunction. So the next question is by Jeannie Bird, which asks, if a male urinates on a pregnancy test and the result is positive, do they have prostate cancer? Well, that's not true, but there is a cancer to be worried about if a man has a positive pregnancy test, and that is testicular cancer. Testicular cancer is relatively uncommon. About 1 in every 250 men in the United States developed testicular cancer in the United States last year. Also, of the about 9,000 new testes cancers that were diagnosed, only about 440 of them resulted in death. So testicular cancer, fortunately, is very, very treatable. However, let's get back to the question. How would it make you P positive on a pregnancy test? Well, in order to understand that, you need to understand the different types of testicular cancers. There are 2 major types that are the most common. There's things called seminomas or non-seminomatous germ cell tumors. Within that non-seminomatous germ cell tumors, there are different types of tumors, and one of those is called choriocarcinoma. This specific type of tumor has these specific cells called syncytiotrophoblasts, which make something called human chorionic gonadotropin. And that's exactly what a pregnancy test tests. It looks for the presence of HCG. And so if a man has this very rare type of testicular cancer, which is less than 1% of all testicular cancers, they could see a positive pregnancy test. However, this is extremely rare. What I recommend for all men, specifically if you're between the ages of 20 and 40, is to do a testicular self-exam. When you're in the shower, hold the testicle steady with one hand and using the other hand, palpate all the way around the testicle. Feel the epididymis, which is on the back and lateral side of the testicle, and feel what a normal testicle feels like, and feel the other side. Do it every month. So if you notice any sort of lumps or bumps, make sure you don't delay and see your primary care doctor or urologist right away. The number one way that people present with testicular cancer is having a painless mass. A lot of times people will even notice it after having some sort of trauma to the testes, and they just assume that it's from the trauma itself. But unfortunately, sometimes we do diagnose testicular cancer. So make sure you examine yourself monthly, and if you feel something, come in, get an exam, and get an ultrasound. It's very simple, very straightforward, and it could save your life. All right, thank you guys so much for watching. Make sure you sign up for my email list down below if you want to be on the email where I answer your questions. Thank you guys so much, and always remember to take care of yourself because you're worth it.